I'm Dr Anita Goraya. I'm a CBT therapist working with Practitioner Health, and I work a lot with neurodivergent doctors and other health professionals. When I say neurodivergent, I mean conditions like ADHD, autism and dyslexia. They're all distinct neurodevelopmental conditions, but they often share differences in how attention is organised, how quickly information is processed, and how much effort it takes to function under sustained pressure. One misconception is that if someone is neurodivergent, they must be struggling with competence. That's rarely what I see. Most of the clinicians I work with are highly capable and deeply committed. Many have no objective performance concerns at all. What's happening isn't a lack of ability, it's the long-term and heightened effort required to work in systems that don't naturally fit how their brain works. A second misconception is that neurodivergence only matters when something goes wrong, a complaint, burnout, or an occupational health referral. But in reality, many clinicians are compensating every day, over-preparing, masking, adapting. And eventually that invisible effort catches up and their capacity is exceeded. Another misconception is the worry that offering support to neurodivergent clinicians will somehow mean lowering of standards. Well, it doesn't. Most people aren't asking for reduced responsibility or reduced duties. They're asking for the right scaffolding, support that reduces friction between the system and how their brain works. So it's not about reducing standards, it is about reducing friction. A second thing to outline is the impact of neurodivergence on mental health. Neurodivergent clinicians are at higher risk of anxiety, depression, burnout and substance abuse, not because neurodivergence is an illness, but because healthcare environments are fast, ambiguous and demanding. Now, if you process intensely, think differently from others, or you struggle to create or maintain structure in constantly shifting systems, that environment can feel really permanently dialed up. And over time, that takes a toll. And people then often assume that the problem is them, that they are failing or not good enough somehow, when the real issue is a mismatch between the person and the environment. It's also important to say that mental health distress in neurodivergence isn't necessarily permanent. What I often see is a tipping point or event for the clinician. Service pressure suddenly increases because perhaps a colleague is on sick leave, or the caring responsibilities within the family change for the clinician, or menopause happens. The overall load rises, and strategies that have worked for years simply stop being enough. Most emotional distress happens when demands exceed capacity, and that balance can be restored with timely support and understanding. Well, firstly, clarity, knowing what's expected of you and receiving timely and structured feedback that leaves less room for guesswork. Secondly, reducing unnecessary cognitive load through technological solutions, structure, and practical workflow adjustments. And thirdly, having some psychological space to understand your own patterns without pathologizing yourself. When individuals and teams understand even a little bit about neurodivergence, the burden shifts. Neurodivergent clinicians bring enormous strengths to healthcare. So if you're struggling, it doesn't mean you're failing. It may simply mean the load has exceeded your capacity, and that can be recalibrated.